A heart attack is most commonly caused by a sudden obstruction of the oxygenated blood supply to part of the heart muscle, such as when there is a blockage in one of the coronary arteries. If the heart does not receive oxygenated blood, part of the heart muscle will die and impact on its ability to function properly. There is real risk that the heart will stop beating. The severity of the attack will depend on where the blockage occurs. Many people who die after having a heart attack could be saved if someone recognised the early warning signs and called for professional help as soon as possible. The recognition, signs and symptoms. Central vice-like chest.
Do you know what the Scott motto is?
Be prepared.
Okay, what about the, hang on just a second.
This man appears to be having a heart attack. Heart attack victims are generally older than 30, but not always. Common symptoms of a heart attack include crushing chest pain, pressure in the chest, the feeling of having food stuck on the way down, pain radiating to the teeth, neck, arms, and jaw, difficulty breathing, a feeling of dizziness or lightheadedness, paleness, clamminess, and sweatiness, and denial or anxiety. While these symptoms are common, a heart attack can also be painless. To treat a heart attack, first shake the victim gently and ask if he or she is okay.
You alright? Are you alright?
Yeah, I'm okay. I'm all right. I just need some water. I'm okay.
What would you do if you see or hear someone collapse who is not responsive? You know to call 911, but did you know that if you start continuous chest compressions, the new CPR without mouth-to-mouth breathing, that you will double the person's chance of survival? Continuous chest compression CPR is a new technique that is easier to learn, easier to perform, and more effective than traditional CPR that recommended rescue breathing. And you do not need to be certified to perform this life-saving procedure. If you witness someone collapse from sudden cardiac arrest,
Put your shoulders immediately over the center of the chest and you fall, compressing it about 2 inches.
It's important that the hands are lifted from the chest after each compression.
Now that's because the recoil of the chest, that causes a little vacuum in the chest, causes air to go in and blood to come back.
It's also important to pump on the chest fast at a rate of 100 times per minute. An easy way to maintain that beat is to think of a disco song like Staying Alive by the Bee Gees.
It turns out that if you try to do 100 times a minute, even if you're not perfect, you have the best chance of getting your body. It's a matter of circulating that oxygen to the tissues that need it. Most importantly, the brain and the heart, so you can respond to treatment.
For every minute you delay CPR, the survival rate drops by nearly 10%.
So if you wait 5 minutes, there's less than a 50% chance now of surviving.
That's why it's critical to pump on the chest continuously without stopping until paramedics or medical assistants arrive. Of course, that can get tiring. So if another person is available, have them take a position on the opposite side of the patient so the two of you can alternate chest compressions. And remember, reporting.